Today's program looks at a major collaboration between Rotary and the International Diabetes Foundation and the implementation of the Caribbean Step-by-Step Diabetes Foot Care Project. Diabetes is a serious condition for the individual and society. The fast increasing global prevalence of diabetes is a significant cause for concern. In 2003, it was estimated that the total number of adults with diabetes was 194 million. In 2007, the figure had reached 246 million. One of the most feared complications of diabetes is amputation of the lower limb. For people with diabetes, ulceration of the foot is a source of major suffering and cost. The average time to heal is approximately 6 months, and up to 28% of these ulcers may result in amputation.
If you have a sore and you don't take care of that, and your diabetes is not controlled, that can turn out to be a gangrenous. Gangrenous means it can get rotten. Suppose if your big toe has got a sore and you don't take care, you might lose that big toe. And it happens very fast, because in a diabetic patient, if your sugar is not controlled, your glucose is not controlled, your immunity goes down, and that's the way it creeps very fast, and you can lose a toe or even a limb, and it can even be a life-threatening condition, because if infection sets in and it enters the blood, then it can be a life-threatening condition.
Let's pause for this message. Welcome back to the program. Globally, the picture is bleak, with a lower limb lost somewhere in the world as a consequence of diabetes every 30 seconds. A total of over 1 million amputations per year. However, it has been shown that through education and prevention, it is possible to reduce amputation rates by between 50 and 85%. A sustainable, integrated educational approach is critical in helping to stem this tide. The Step-by-Step program is one such education initiative for teams of doctors and nurses or paramedics. This is a two-step basic and advanced level training program for healthcare professionals and has been successfully pioneered in a number of countries including India and Tanzania. The aim is simple: to reduce lower limb amputations in people with diabetes through education and the improved management of the diabetic foot. Dr. Abbas.
If there is a callus or a cone, they will start cutting themselves, applying a cone plaster, which is not right for diabetic patient. They should not do that. Cutting nails, it has to be cut properly. If they cannot see because of eye complication, they should not do it. They should leave it to the health professionals. Podiatrist comes there to do these things. You see, so this is what we are trying to do, trying to teach the health workers, and it's now their duty to go and teach the patients, educate the patients, have sessions with them, and educate their colleagues as well who are in the hospitals.
Local podiatrist Deborah Charles is well placed to assist.
They send me data on the amount of ulcers, different classifications, and so we're putting that together to see whether or not we reduce amputation. So we are going to have follow-ups as in the practical session, keep doing the debridement, because next year when they come over, we have to do further.
The intention is to develop this program as a Caribbean step-by-step diabetic foot care project built around local teams with support from the International Diabetes Federation and Rotary. If you or someone you know has diabetes, the best thing you can do is to find out as much as you can about how to care for the diabetic foot. This just might be the difference between keeping your feet and losing one. That's it for today's program, looking at a major collaboration between Rotary and the International Diabetes Foundation on the implementation of the Caribbean Step-by-Step Diabetic Foot Care Project. Join us again for another program in the series.